Welcome to this presentation on how to work with language interpreters in a medical setting. This is a brief overview on the basics of working with language interpreters, including some standards you should expect from trained interpreters and which you may share with those interpreters who are not trained or certified. There are other videos on this Lundstrom Language channel that you can view to learn more about each principle presented in this video. Doing a pre-session. Trained interpreters should talk to you before entering a room with the patient. This is called a pre-session. It is understandable to be busy as a medical professional, but unless it is an emergency situation, you should take the time to speak with the interpreter to get some instructions on how that particular interpreter works, as they all work slightly differently. These are the main points of what should be done in a pre-session with the interpreter. You may introduce yourselves. The provider will receive instructions on how that particular interpreter works, and the interpreter and provider can determine any special issues concerning the patient or this particular session. Speak directly to the patient or provider. In order to focus the attention on the patient, or the provider if you are the patient, ignore the urge to look at the interpreter while they are talking or while you are speaking. Trained interpreters should have the habit of not looking at either party unless they are trying to pick up on body language through their peripheral vision. Look at the patient and invite them to look at you. This will help build the proper relationship that a patient and a provider should have in order to ensure the best care and service for the patient. Take pauses. Interpreters will be more accurate and more helpful if you take time in between phrases to let them interpret. Many times, interpreters will raise their hand to stop you if you have not paused to give them sufficient time to give your message to the patient. It is easier for the interpreter to interpret correctly if not listening and speaking at the same time. Because of this, you should remember that appointments that require interpretation will likely slightly be longer than a typical appointment. Interpreters will interpret everything you say. As interpreters, it is part of the job description to facilitate understanding in communication, even if the communication is not positive. Interpreters will relay everything a provider says and everything a patient says, no matter the intention. Do not make offensive comments or jokes that may be misunderstood. It is also important to use common language, if possible, to ensure clear communication. If you enjoyed this video or you found it useful, please feel free to view the other videos on this channel to find out more tips on working with interpreters.